Great pleasure to be here, and I'd like to thank the organizers. I'd like to say, first of all, I don't have any conflict of interest, and I should have my email here, but it's murphy.joseph@mayo.edu. So if you have any questions on pulmonary hypertension, I'm happy to respond to you. So let's talk a little bit about pulmonary hypertension. So I like to show this slide of zebras, and when you look at zebras, there's a reason for their camouflage. So if you're trying to attack a zebra, it's very hard to work out where one zebra starts and one zebra ends. So if you're the unfortunate lion, it's kind of hard to know where do you start. And this is a deliberate strategy because obviously zebras stay together in packs. So pulmonary hypertension is kind of a little bit like that. It's the zebra, and when patients present, they usually present with shortness of breath, and gosh, it could be a valve regurgitation, it could be heart failure, it could be ischemia, it could be obesity, it could be asthma. But in among these, there is the zebra, so you always got to be careful. And I think this is just this wonderful slide which kind of epitomizes the difficulty. So let me go through a little bit of pulmonary physiology because this is really, really key. So the first thing you have to realize is the pressures in the pulmonary circulation are very, very low. The lungs should offer almost no resistance to blood flow. And the pulmonary pressures should be very low. And there's a specific reason for this, which is likely linked to an evolutionary mechanism. So this is the alveolar capillary membrane, and this is the red blood cells, and they do actually line up like this. And when you get to this level, you want to be able to suck in the oxygen very, very rapidly. So the whole key to have wonderful lungs is having this very, very delicate membrane. And you see it better here. So this is the alveolar membrane. But if you appreciate this, this is a red cell here, which is about 7 mu across. But the membrane is actually about 1 mu. So that's 10 to the minus 6 meters. So you're talking about extraordinarily thin membranes. And the lungs can do this only if the pressure is low in the lungs. So one of the hallmarks of pulmonary hypertension is that the basement membrane thickens in the lungs. And this is the basement membrane here. And then you can no longer suck up the oxygen as rapidly as you used to be. So remember that the determinant of your exercise capacity